Okay, I'm Dr. Deuk. We're here at the Deuk Spine Institute Surgery Center of Viera, and this young lady just got done with her Deuk laser disc repair surgery. She had back pain and right leg pain, so I'm going to have her tell you a little bit about it. How long did you have lower back pain for?
About 20 plus years.
Okay. You said since you were in Vegas, right?
Yep. We lived in Vegas for a few years.
So you lived in Vegas and retired in Florida?
Yeah, we lived in Vegas, California, Wisconsin.
All over. And the back pain followed you?
It followed me everywhere, yeah.
Yeah.
I used to do physical therapy in the water and out in Wisconsin, and they tried injections, and I've tried everything.
Injections and everything, and you even were offered fusion surgery in Vegas, right?
Right.
And why didn't you do it?
No, thank you. I want to be able to move.
She didn't want to lose her movement with the fusion.
I like being active. I'm really active, even with pain.
Okay. So why did you decide to do the Deuk laser disc repair surgery?
Because to me it just seemed like the ideal thing. Why wouldn't it work right? you know?
Yeah, we sat down and figured out the pain was coming from 2 discs at the bottom of your spine. And so let's talk about your pain. You had pain when you came here today that you've had for over 20 years back here.
Right.
Do you still have that back pain?
I have no pain. Actually.
It's gone.
Yeah, completely gone. I have no pain.
Now you had pain down your right leg all
Right.
the time, right? Do you still have pain down your right leg?
Well, right now I don't.
She doesn't. Now she had a little bit of piriformis syndrome, which is a strain on the muscle in the buttock. We gave her a shot there as well. Her buttock pain, still have a little bit of tenderness down there?
Just a little bit.
A little bit, but her right leg pain is gone, so cured.
Cured.
Yeah.
I'm so happy because I love being active.
And you're going to be more active, but not too soon.
No, I know.
Yeah. So no lifting over 25 pounds, 6 weeks, no bending over. That's what this is for.
And that's what I'm wanting to help with.
Yeah, he'll keep you in line.
Right.
All right, where are you headed now?
Home.
Awesome. So you're not in a hospital, you're not staying overnight.
Nope.
It's outpatient.
Right.
And look at that smile. That's a beautiful smile.
I'm so excited.
That's the smile of a woman who is free of pain from 20 years.
Right.
All right, good for you. Congratulations, guys.
No, thank you so very much.
You're welcome.
I mean, thank you so much. This has
You're
just
welcome.
been godsend.
You're welcome. My pleasure. All right, thanks.
All right.